Today I'm going to show you how to adjust a Suad oral appliance for snoring and sleep apnea. It is held together by a button on the top and the bottom tray, held together by a rubber band on both sides. You need to remove the rubber bands. Once the rubber bands are removed, the appliance comes completely apart. This is needed because we have to add on the spacers, and the only way we can do that is to take the appliance apart. This is the lower arch of the appliance. You can tell because it has two screws on the bottom. It also shows two little round discs. Those are called spacers. The black is a full millimeter, the red is a half a millimeter. If a patient needs to advance their appliance due to snoring, all you have to do is hold the lower rod, it's a closed-ended rod, in your fingers like a little pencil. Go toward your spacers, use either 1 millimeter or a half a millimeter, which is based on symptoms. Take the rod and push directly straight down into that plastic spacer. It will not come off. I usually just take my finger and push it on a little extra so you see a little bit of metal at the very end of the rod, which makes it very easy to add the upper tube, which is open, to telescope the spacer all the way to the end of the rod. Now, whatever you do to one side of the appliance, you must repeat to the other. So I would take the other rod, hold it in my hands, press directly straight down into the spacer, give it a slight push with my finger, use the upper tube, and telescope it right into place. You now have adjusted it 1 full millimeter. Now you have the two trays that are completely separated. This shows that this is the inside where the teeth goes. It is open. This is a closed side. It's closed all the way around. You take the two closed sides and you match them together like clapping hands. You insert the rod inside the tube and lay it down. Turn the device over. You may set it down on a table if it works best for you. Open it slightly. Insert the rod inside the tube. Finish it off by adding those rubber bands from button to button over the top of the tubes, just like that. Repeat the other side, button to button over the top of the tubes. Oral appliance is put back together and it's ready for insertion.
It's also important to note that once the ideal position is adjusted to and confirmed, this is not something that would be needed to be repeated often.